Gentlemen, you are both drunk on cosmic wine.
Welcome to the show. I'm Dr. Mark Sylvester.
And I'm Dr. Richard Schulman. This is Alt Psych. I'm ready.
I'm ready.
Are you ready?
Ready to talk about today's topic, which is the mental health crisis, right? That's going on these days on planet Earth.
Well, the mental health crisis goes far beyond our mental health patients. It goes into our mental health practitioners. That's the big crisis, I think. Maybe not. It's our big crisis anyway.
I think you need to kick it off with a mental wealth tip.
It's a perfect mental wealth tip for what we are talking about.
Absolutely.
Here's the tip. Your feelings are always going to be valid. Your reactions may not be quite so valid. In other words, you can't choose your feelings. You can only choose your behavior.
I like that.
Oh, that's your mental wealth tip of the day, and I feel wealthier already.
Short, sweet, and deep. Thank you for that.
You're welcome. You're welcome.
So let's kick it off. We're talking about the mental health crisis, specifically how mental health's been affected by humans. We might stick to Americans, but this, of course, applies all over the globe.
Absolutely.
This was a global pandemic, right? And a lot of time has gone by, and the end is possibly in sight, but not really clear how, when, what it's going to look like. And that continues a lot of the issues that we're going to talk about today. But, you know, when we first approached this topic, I think, no shit, Sherlock. Mental health was bad before the pandemic. There was a shortage of mental health professionals, specifically psychiatrists, long before this hit. Matter of fact, the trend was actually getting even worse before COVID put a nail in the coffin. I don't know if they're ever going to get a medical student talked into going into mental health again to become a psychiatrist. What do you think?
Not if they can get paid more doing something else.
Yeah. And the burnout is real. And that's kind of what we wanted to focus on today, is not just healthcare burnout, but specifically mental health care burnout.
Well, I've thought about the concept of burnout for a long time because, I'm dealing with it really every day with patients and myself. Burnout actually is when, to kind of put it in perspective, yes, enjoy, is when you have a lot of responsibility and no control. Think about how little control people have had regarding the pandemic. They don't know if they're going to get sick. They don't know if they're going to die. They don't know if they are sick. Okay, that's a big one. They don't know if they're going to have a job. They don't know if they're going to pay their rent, and they don't know when it's going to end. No control over so many things in life. Now, that attitude comes into our office every day. We may have some of the same fears,
I think we should mention that we're recording this on April 30th, 2021. Because the state of affairs with what's going on and regulations and mandates and repealing mandates and all of that changes very quickly. I'm hopeful that we can get our kids back into school without the mask mandates and all the plexiglass that goes along with it. But I think,
you want to hear how crazy it is. Like you don't know already, but I'll just add to the fun. I have a patient who told me that most of her son's class was put into quarantine, but her son was not. What they did was they drew a 6-foot circle around the kid that had the first infection, and any kid that was in there more than 15 minutes had to be quarantined. Everybody else didn't have to be. How they determined this as the cutoff point, I really don't know.
That was my first thought,
It's really amazing. It's really amazing. It's This law's, what does it say? The story about here is true. I know because I made it up myself. Is that kind of
Hmm.
what we're dealing with? But in any event, the idea that this is coming to an end, I hope you're right, but I don't see any real signal that it is until it's
Well,
sort
as
of
of
politically viable.
yesterday, the Surgeon General of Florida no longer recommends masks be worn in restaurants, bars, shopping malls, grocery stores.
Well, Florida has had a different view of this almost from the beginning. I feel like we've been living in Sweden, actually, uh,
A little bit.
without, without all the beautiful people, but the
Hey,
the
speak
I
for yourself.
it's been more. It's been. I consider you're sort of one of those Viking kind of characters, aren't you? Um, yeah, there you go. I feel better already. And the Lightning have Victor Hedman, so that's always good. He's from Sweden. But the Florida has been radically different from most of the states in the United States, almost from the start. I saw that the CDC now recommends you don't have to wear a mask outside.
Correct. That's the CDC. I was speaking about Florida
No, I get it.
Surgeon General, and now New York. Have you heard New York, as of this recording, has also repealed all of their mandates for the city?
Is anyone left in New York?
No, they all died from COVID.
I thought the only one left is
Said the bad
Snake
word.
Plissken from. Remember Snake Plissken from Escape from New York?
Let's define caregiver burnout, because I
Okie
think
dokie.
you have to have an understanding of what that is. I mean, I think people know basically what it is, but there's some pieces of it or components I want to refresh, just so you're thinking about these through through that lens while we go through not only some of the issues that we found in our research, but also some of the quotations that I was ran across directly from various types of physicians or therapists.
Well,
Um,
caregiver burnout in general is just a state of physical, emotional, and mental exhaustion. I mean, we see it. When I worked in the VA, they had a program called respite where they would, if there was a chronically ill, like a person who had Alzheimer's or dementia, let's say, they would put the patient in the hospital for the weekend so the caregiver could have a weekend off. And I thought that was, in the long run, very, very brilliant,
brilliant. It's
you
it's
know.
brilliant. We need something exactly like that. Um, I don't know
And,
what it
and,
would
and
look like, but
well, and I don't know what it would look like either, because that would be, sort of pound wise and,
penny.
save money in the long run, but, we don't actually live like that. Anyway, you see burnout and a change in attitude, especially in therapists. We tend to want to be positive and caring. And, if you're starting to get negative, and sort of, I was good, it could be unconcerned. I don't think we get unconcerned. I think we get frustrated and a little bit pissy when we can't make an impact. And, you know, um, psychotherapists, mental health people are the worst at getting the help they need. Even though, the way it started was and psychiatrists had an edge on this because psychiatrists initially were forced to get psychoanalysis.
So I
Uh,
was
Yeah, and
during
I don't
training.
think it's true anymore, but it used to be true that they had to. And we all, as caregivers, I think we're sort of constitutionally trying to do that more than we can.
Well, the caregivers are often so busy caring for others that they, whether they're conscious or not of it, tend to neglect their own emotional or physical or spiritual health or the relationships with their family and friends. And, it's certainly the work we do can lead to isolation if certain safeguards aren't put into place for emotional recharging. And I can't remember if I have this written in our script or not, but um, one of the recommendations that I found was to take a vacation at least one day every 3 months, which is very interesting because you and I have talked about this before, and how it seems like about every 3 months you start to feel it building up and feeling squirrely.
Yeah, I need a week every 3 months, but
Yeah, I thought
I
it was,
rarely actually get it, so.
yeah. Well, it's gone down since the pandemic, so that's something personally that's affected you. Um,
Absolutely. Well, I guess partially is because I don't know where to go. I mean,
did
I don't
we
want to go somewhere to quarantine for 2 weeks. It doesn't make any sense.
did we already cover kind of that role confusion and the
No,
unrealistic? No.
no.
Um, because there's other considerations, I guess, that specific to caregiver burnout. Um, being a problem if you have a role confusion, which is essentially like, how far do I go with this patient? What's my role in helping them when I can't give this level of care to all my patients, or I'm not.
How big a waiting list do you have also? I mean, there are we supposed to save the planet, and people are really hurting out there and I'm happy to be able to work with people. What about the people who are on my waiting list? It's very hard to find a therapist nowadays.
It's almost impossible if they take insurance, but even the self-pay ones are booked at least 3 months out on average. And going back to what you were saying about unrealistic expectations, well, actually, what you were talking, how far do we go? We put those expectations on ourselves. The caregivers are the ones that say, "Hey, this is my job. This is what I'm designed, built, and worked and trained to do." And doing what I do, I expect the effect on the patient to be a positive one. I'm used
Right,
to
right.
seeing the positive outcome on the health and happiness of my patients, but that really has been a much more elusive goal since the pandemic, because the stressor is ongoing
Well,
and
nobody,
multifactorial.
nobody, nobody has trained to be a psychotherapist during a pandemic. I mean, and if you think about it, what it feels like is we're almost medics during a war because the war
Mhm.
is, I hate to think like, we have the war on drugs and the war on cancer. I'm not thinking about this essentially the same way. It feels like bombs are going off everywhere, every day for people. They're being pushed into this, the death count, the new variants, this vaccine worked, that one didn't work, all the debates and things and what the truth is in terms of what we talked about with the bioethics expert, what people believe, what they reject. I'm not even thinking about that. It's the amount of stress really fits the diagnostic criteria for post-traumatic stress disorder. Only it's society-wide, probably
Yeah.
worldwide.
And it's a lack of control, I think, that helps uh, make it even more difficult to avoid burnout if you're not taking appropriate steps to recharge or to limit, to set healthy boundaries. And we'll talk about that a little bit later in the show. But tell me what you think about unreasonable demands as another factor that can lead to caregiver burnout.
Well, number one, the symptoms that we're facing are worse. And patients being upset about all this, being on edge, they're going to call us more often. The things we have to deal with are more difficult. We have less time, and consequently, we don't take care of ourselves, as we talked about. We're not going on vacation. I know we're both working later. Um, I personally reached that point a couple of months ago where I just said, I'm cooked. I can't do this. But it was an interesting experience. I sat and meditated on it, and all I got was the message, up your game, man.
Where'd you
Just
get that
relax a little
message from?
bit. In my head,
Okay.
I relaxed and I just meditated and I got the inner message,
You
up
know
your
what I
game.
got?
What, up your something else?
No, I got physician heal thyself.
Oh, that was good too. I think it's similar, up your game meant both do better and relax into it.
Well,
Stop.
the other factor we can't ignore is that a lot of times, because it's us, we don't recognize symptoms when we're suffering or burn out, or eventually get to the point that they can't even function effectively, and maybe we're getting sick. And what's interesting is, tell me if I'm wrong, I used to see this in you, which was surprising to me that I felt like you couldn't see it in yourself.
Yeah, well,
And remember
you're one of
when
the smartest guys I ever met in my life, and you couldn't see it in you.
no, no. And but remember when we used to have breakfast or lunch every week in your old office, um, I'd say hi, give you a hug, and usually could just tell based off your aura or your energy. Sometimes wouldn't I just say something like, "Hey, Rich, it's time to take a vacation."
You mean when I would crawl into the lunchroom instead of walk?
Right, yeah. Like,
Yes, you would, and I, of
so
course, probably didn't listen. No, I mean, when I could take vacations, I did. But there's something about the
sometimes you
pandemic.
needed prompting to take the vacation because you had it on your mind for 3 months, and it's like, no, it's time now.
Hi, Mark. How are you?
Exactly.
You're right. I did need prompting, and it really, the funny thing was, it was the idea, actually, the idea of taking the vacation. It's funny. I would be so wound up. I would get on the plane, sit down. We hadn't even backed away from the terminal. I hate that term for an airport, by the way. And I would feel the stress go shh. It was really remarkable. It was sort of like, I know I can shut my mind off now for a couple of weeks. And it is one of the biggest problems, I think, that mental health people, I know I'm having it, I suspect you are too, is the volume of it's like the postman. I had a patient, great guy, by the way, who was a postman, and he told me, why postmen go postal is because it never ends.
Yeah, that's a golden observation there. uh,
He also said, what it means when the flags are half mast at the post office? He said
so-
they're hiring.
someone went postal.
Yeah, they're hiring. Um, the idea that we don't take care of ourselves and it's never ending is key here. The pandemic is never ending, is what it feels like. It may be, but it doesn't feel that way.
When I
We feel we have to do more.
Right.
It's a bad recipe.
What I was going to say was, when I first saw my community, my state, my country, let's be honest, does anyone watch this besides my friends and family, if even them? When I saw that first occurring was when the very first social distancing measures went into effect, because I immediately noted that people heard social distancing and did psychological distancing. And I really worried about that because I saw that connection just break, really just break.
Yeah,
We
I
don't feel the
totally.
interconnectedness, not only to our community and even our relatives, what we haven't seen in a long time, but even within the home. You bring that home, and you're not the same person you were before, and it can cause additional problems and stressors at home. We know domestic violence has gone up. We know all kinds of mental health statistics, some of which I'll get to here in a minute, have gone through the roof. It was a crisis before this crisis started. So when this
Totally agree.
crisis is over, the mental health crisis will remain.
Absolutely. I think there's another piece that um, our culture is touch starved and touch phobic before there was a pandemic. Now, kids are afraid of breathing because they're going to kill grandma. Um, the level of fear far outweighs the serious, it's a serious situation. but for children to be afraid of breathing is not a good idea. Um, and what happens is the fear, since it's everywhere, you can't escape it.
Yeah.
It's with you, you know. You're sort of wondering, you're hesitating, and it goes in so many different directions. There's a lot of people are just afraid of losing their rights. Other people are afraid of getting
Dying
sick and dying. Other
or
people are
family members.
afraid of the treatments that, or the preventions that have been proposed. Everything we do seems to be about fear and conflict. You spoke several months ago what would happen if there was an alien invasion. You know, we would all band together. It's kind of like Will Smith in the Independence Day movie, and we'd fight these guys. I
Kick
don't think
their asses.
there you go. I don't get a cigar and everything. I don't know if we know who the enemy is anymore. Who are we supposed to fight at this point?
Well, that's an
But
interesting.
in any event, we do know that many people have lost their jobs and businesses. Many people are isolated, either by choice or by mandate, for months. I know of several people that I treat through telehealth in colleges who basically have been on house arrest. They've been in their rooms, except for meals, for about a year now. All the classes are online.
And can I ask you, because this is really interesting, are you seeing this as well, that frequently when you do online visits and they have been quarantined and they have isolated, have you noticed that when you're seeing the patient, it's in a dark, dingy room? A lot of times
Um,
they have the blinds shut, the lights off. Is that just an artifact of my patience or my perception? Or like I'm thinking if I were on house arrest, I would want to be on my property. I would like to be outdoors where I could. If I'm in an apartment and that wasn't appropriate, then open the dang windows,
yes,
open
I
the
actually
doors.
have noticed it. I've actually
Weird.
noticed more that what you'll see is stuff that you wouldn't ordinarily see, like the bed won't be made. There may be, adequate lighting, although many times there isn't, but the bed won't be made, or there'll be a total mess somewhere in the background. Um, Almost like, I don't care what you
What's the
see.
point? Yeah.
Yeah, what's the point? Exactly. And
I
the
call
thing
that
that
hopelessness.
thing that we forget, at least in this office, is that the S on your underwear and mine, yours stands for Sylvester, mine stands for Schulman, not Superman. And we think that we can get away with not taking care of our basic needs. And as mental health practitioners, what is it you said, that heal yourself, doctor? I
Yeah.
think.
Physician, heal
Um,
thyself.
yeah, there is that piece. I have noticed personally that I play more music now. I play my guitar more. Um, I started doing yoga again when I felt a little better. We have to be really mindful of taking care of those things.
What about, well, probably the last thing that I'll say on, uh, I guess, factors contributing to the caregiver burnout before going on to some statistics is basically, um, yes, it was necessary to incur some of the public health measures. Um, but a consequence of doing that is it created these public health problems where everyone's on lockdown, like you said. They're experiencing situations as a consequence of a mandate or a lockdown or whatever, curfew, that are linked to poor mental health. This has been studied and proven even in the short amount of time, less than a year. So outcomes like isolation, a lot of people lost their jobs, of course. Anxiety, wouldn't you say, is the number one increase in symptom mental
I
health
don't know,
symptoms.
depression, substance abuse, running neck and neck with anxiety, but I'm not going to agree so quickly
Well, I got the
that the
statistics right here,
no,
buddy.
that the depth of the public health measures were necessary. We went from 2 weeks to flatten the curve, which I thought was reasonable given the nature of things,
Yeah.
to months and maybe even a year in some places of stay inside. And there was no scientific data that showed that that was uh, the risk was worth the reward in terms of public health. And I think the moving of the goalposts repeatedly made people crazier. Once again, no loss of control, no structure.
Yeah,
Um,
uncertain of the repercussions of the pandemic and how long is it going to last. It's like the divorce. We just don't know.
yeah, actually, yeah, I hear you. And,
Divorces usually take 2 or 3 years, right? This pandemic will end in 2 to 3 years. Vaccines have hopefully push it closer to the two. But people, I shouldn't probably have mentioned that because I don't want to take away hope for anybody. But I think if you know what you're up against, I think people have enough wherewithal and acceptance and understanding that you're giving them true facts that they can handle it. It's
y-
not knowing what you're dealing with that drives them crazy. It's kind of like when you hear, you've been getting these symptoms and all these doctors can't figure out where it's coming from, and finally one hotshot doctor says, "Oh, hey, you got cancer." You say, "Oh, thank God, it's cancer." And it's like, what?
well, the other thing is, I don't
How do
I
I know
don't
what I'm
see
fighting?
the vaccines as doing it either, because if you look at what they say about them, you can still get COVID, you can still transmit it. So how is that? It may end it in people's
But the
minds.
people that don't believe that or are unaware of that are still in a comfortable bliss of, I got my shots, nothing can stop me. And
Yeah,
maybe that's a great place,
until it does,
but
and
maybe
then
that's a great
what?
place to be emotionally. It's a catharsis.
Yeah, well,
Getting that shot
I don't
was
want
the
to know a lot
worst.
of things that I know either, but I can't help myself, and I think as people become more aware, it won't be helpful if they feel like they were lied to
Yeah.
or
Well,
misinformed.
hindsight
We're
will
back
be
to the lack of control, you want good data. We don't trust the data that we're getting, and I think with good reason.
wait until we look back on this and with objectivity and hindsight. And yeah,
I I don't think I'm gonna get that old. I
I
don't
think
know,
it'll
man.
be very, very different from how people wished they would have acted during the event that they lived through. But let's get to statistics. 'Cause
Statistics,
I'm a
let's
numbers guy.
go.
I'm a numbers guy. I like numbers. They make me feel comfortable and
I know
fuzzy.
I like it that you like numbers. I like letters, but
Florida,
I'll go with numbers.
Florida, or however you say it,
Florida,
Florida
Florida.
is ranked number 8 in this country, in the US, so far, as of April 30th in 2021, for the prevalence of mental health problems.
That's because we imported them all from New York and California.
I wish I saved 1 through 7, but I can tell you,
Okay,
like rural, Texas, Mississippi, they were in there. It was mostly your rural South.
okay.
And providers, we've talked about this, are burned out by the pandemic. Did you know that 3 in 10 healthcare workers seriously have considered leaving their profession as
Well,
a
I
result?
remember a statistic we talked about several months ago where it was 30% of caregivers had considered suicide.
Hmm.
I mean, that's a pretty high number, and they weren't all professionals, but this is amazing. 3 in 10.
And 6 in 10 say that the stress from the pandemic and taking care of patients has harmed their own mental health. I'm surprised it's that low, quite
I
frankly,
am
because
too.
I do not think any mental health professional, if we're sticking to mental health, is immune to this.
How can it not be? I mean, you're in an emotional toxic soup all day long, and the toxicity got higher and the density got stronger. and the duration of time you're in it got longer. So how could you not feel it more?
And when you talk directly to the providers, whether they're frontline workers or just or mental health professionals themselves, I want to give a couple quotes from some frontline because I think that they deserve a little bit of accolade here as well and representation. But one ER doctor was quoted as saying, you feel expendable. You can't help thinking about how this country sent us to the front lines with none of the equipment needed for the battle. So, kind of, here's an ER doctor saying, "Hey, I really felt abandoned, ill-equipped, unprepared."
I could tell you a great personal story. My son is a mental health counselor in Boston, and he volunteered to run a quarantine unit. The company he works for does a lot of drug and alcohol work. So they would have it, we're having patients showing up positive. He volunteered to set up and run a quarantine unit. And one day they were out of personal protective equipment. And the CEO said, no, you got to go in anyway. So my son called him up personally and said, you go. I'm not, none of my people are going. I'm not going. Fire all of us. 7 o'clock in the morning, all the protection equipment arrived.
And that's another stress that, quite frankly, healthcare workers should not have to deal with
Absolutely.
is that battle to get what's the minimum to protect them.
Really, really.
Many talk.
I was proud of him. I gotta tell you, I was really
Okay,
proud of him that
right.
he drew the line. He said, "Fire me. I don't care. My people are not going in, and I'm not going in. You take care of them."
Many talked about the betrayal and hypocrisy they feel from the public that they have sacrificed so much help to save. Now, these are frontline workers, these are your doctors and your nurses and your first responders, and these are the boots on the ground that are seeing the worst of the worst of the medical side of things. Basically saying, hey, we don't need a pat on the back to telling us that we're heroes, but we'd prefer not to have, dirt kicked in or sand kicked in our eyes um, when we see all these people out here uh, not following recommendations. They feel betrayed by the public, and then they also feel betrayed by the establishment, the medical establishment. You can see how that would make a provider feel very isolated, very alone, very much like a tiny, you know, cog in a wheel. And that leads to their own depressive symptoms, anxiety, learned helplessness. Uh,
Well,
and they don't,
you're getting hit from both sides. The public is frustrated and scared, and they're looking for somebody to take that out on. You're not getting supported by the higher ups. Um, or you're actually getting criticized by the higher ups because they want your numbers to be a certain way. They want you to make a certain amount of money for the institution. And getting hit by both sides doesn't give you a lot of control. There's your burnout, lots of responsibility and no control.
well, here's a statistic: 7 in 10 of healthcare providers say that the United States has done a poor or only fair job handling the pandemic. So these are people that I would think are more um, competent and able and more appropriate, I guess, to ask how they're on the front lines. How good of a job is the government, is the hospital system, is the community? Sometimes the county, if they're having to close parks to convert them to injection sites and stuff like that.
Well,
70.
but I mean, if you look at how much of the response has been political, and I remember Governor Cuomo screaming he needed ventilators, and I think they made a landfill in Miami with all the unused ventilators, because they had all these contracts with China to bring in all these ventilators, and it turned out we didn't need them. Or they really people were dying when they were on them. The bottom line is there was a lot of knee-jerk reactivity in public, And the frontline healthcare person is the one who takes the brunt of that. The governor doesn't have to. The frontline person
Yeah.
took the
And the
brunt of that.
general public doesn't either.
Absolutely. But they have to go somewhere. And the frontline person is also a member of the general public when they go home.
Mm-hmm.
And where are they supposed to go? I mean, that's to me a real important point.
Here's a quote I found interesting from an anesthesia doctor. He says, you look at staffing, preparedness, what the priorities were for many hospitals during the crisis, and it's clear the industry is driven by profits rather than the well-being of patients or of the healthcare workers themselves.
Gee, that's a shock to hear. I hear that it's right out of Casablanca where, the guy goes gambling. I'm shutting you down because there's gambling here. And he goes, here's your winnings, sir. I mean, this is what we debate all the time in healthcare is it's profit over patients. And we could go into that pretty deeply if we wanted to, but it's the reality of our system. The old Chinese system is that as long as you were well, the doctor got paid, and when you got sick, the doctor didn't get paid. Well, that was a pretty high motivation to keep
That's a
you
good
well.
that's a good model.
Yeah, well, good luck with that one. So, it becomes really focused when we get to the mental health practitioners.
Well, we're getting there now. Let's talk about
I know,
mental health practitioner burnout. I
burnout.
got
Well,
a few words to say about that.
I'll bet you do, Sparky.
I just did a burnout in the parking lot out there. Oh no, I'm sorry. I had that burnout mixed up.
I think that was called a meltdown,
Yeah.
actually.
Yeah. Um, well, so here's some interesting stuff.
Okay.
Mental health professionals, they're helping their patients cope with stress, anxiety, sometimes unimaginable loss because life continued to go on despite the pandemic interfering with it. While they're always also trying to manage their own concurrent suffering, loss. We've had friends lost to COVID or to the vaccine itself. And there's the same amount of struggle and issues, and that maybe that's what you're alluding to before, that here, who's heal thyself, who's doing the care, where, what happens is I just walk into your office and unload on you, or any of my other dear friends I trust to know that I'm stressed out. But heavier caseloads, with more severe, like you said, they're more severe symptoms, more trauma, unfinished trauma. Are we going to
I
get
think I
chronic
think it
PTSD?
activated long held stuff for a lot of people, and because it's sort
Absolutely.
of like the trauma resonated with the trauma they already had.
Hmm.
I've seen things in the last 12 months I've never seen before, and I've
Yep.
been doing this for decades.
Yep. Me
And
too.
I don't get shocked very often, but I was literally shocked
It's
at
bizarre.
the number of suicidal attempts, ideation, um, you know, the amount of substance abuse relapses with our patients who have been clean for sometimes for decades, the domestic violence kind of stuff, the breakups in relationships. We've always had this stuff. The intensity has been unprecedented in my world, and it's borne out with what we read about and even talk to. I know people in other states. They tell me the same thing.
Oh yeah.
And on top of everything else, um, we patients can't even get to a therapist now. We're all
Well, so
booked.
what's interesting is most psychiatrists and therapists have made the transition to telehealth. We've talked here, it wasn't a big deal for me personally, because it is something I've been doing for 7, 8 years. But therapists before the pandemic, when I would approach them and try to get their feelings about telehealth, they didn't want to do it. They felt like it was a lower quality care. They didn't have any experience with it whatsoever. But overnight, when the quarantine when the lockdown happened, not only did they learn how to do it, they actually preferred doing it for a variety of reasons. And we've talked about this on the show before. When this ends, whenever the authority says this pandemic's over, a lot of these people aren't going back to an office. Or if they are, it's for an extremely limited amount of time. So I do
My
think
my son in Boston started his private practice about 2 months ago. He's filled with every hour now that he has available, and he doesn't have an office. Everything he started with telehealth, he's never going to have an office.
but how much more stressed is a therapist who's late in life, who's still making handwritten notes, doesn't have an EMR, doesn't know how to use this technology
Oh,
for
I think,
telehealth
well,
conferences? You think they're stressed?
because I had you, it was actually seamless for me. When I made the transition, um, it was sort of, well, this is what's in front of me, and I know, and I knew that you've been doing it for a long time, and you've been encouraging me. So I just, well, here we go, here we go, and it was really not that bad. There was some frustrating times when we wouldn't have bandwidth and things would cut out, kind of thing. But that was minor compared to the ability to interact with people, at a time when I literally didn't have an office I could go to.
I saw a really great podcast called How to Work from Home Without Bringing Your Work Home.
Yeah, I can't remember. Didn't
Oh, we did that. I'm being told we did that one. Great podcast. And
we
that
did
is
it?
another stressors is many providers find it difficult to disconnect and separate their home and work life. Um, they're supposed to be in work mode in this room over here and then come over here and be in home. Our brain doesn't work like that.
And there was no decompression for a lot of people. I know I do it. The drive home is when I sort of, that's the distance so I can be like almost a normal person when I walk through the door.
Oh yeah.
Having 20 minutes in the car actually was really helpful. Put on some loud music, and get the day out of my system. When you're in the house, where the it's not even 20 seconds. You're just, hi, how you doing?
Here's a fun one, Rich. What do you think of this? Nearly all clinicians interviewed felt guilt for the answers they could not give their patients and for the number of patients they had to turn away because they were so booked up.
Absolutely. I
That
don't find
applies to
that
me.
I don't find that hard to believe at all. I've made peace with the answers that I can't give to people because I had to make peace with that before the pandemic. It's the people I can't see that I feel bad about.
Sure.
I've said many times I need to clone myself a couple of times to see all the people that I would hope to see. But we're back to the postman thing. The mail, it just keeps coming, coming, coming. Now I'm grateful to have the work. Don't get me wrong. I'm very, very grateful. This is what I love to do. For a lot of people went into psychotherapy, psychiatry, psychology. They don't love it. If you don't love this stuff, you're going to find out right now.
Oh, you've already found out. Yeah.
I absolutely love what I do, and I love the people who come here. And I like chocolate cake too, but I don't want a cake as big as a couch. I don't think I can eat it in a day.
Yeah.
Um, and it's, for me, it's more when I feel powerless that knocks me down. I think a lot of clinicians are reporting that. So somebody comes in and they'll say, "Oh, well, my mother is got COVID and is in the hospital. I feel terrible." Well, you're supposed to feel terrible. What am I supposed to do about that? I don't want to say that. Of course, I want to soothe the person, but I feel powerless. And when is this
Definitely.
damn thing going to end? So we can get back to business, the business of life. You
Well, the
know,
quality of your care is shifted from, I don't want to say offensive, but doing what you did before. We're being pushed on our heels because the powerlessness, the feeling of powerlessness is directly because we don't always know what to do other than just be present with the client and validate what they're experiencing. Whereas before, we did know what to do. The issue was different. It wasn't something concurrently we were going through. And we were more leaning on our toes and able to help. Now we're just sort of trying to catch people from sliding backwards. And
Yeah.
that's I think a big reason to contribute to burden or
Well, the way
burnout.
that the way that I've worked it out in my own mind in terms of helping people is I try to gauge, is their response over and above what I would expect a healthy person's response would be. Everybody's going to have some level of anxiety, some kind of trouble. When it's over and above, I'm looking for, is there a precursor to this? Is there another trauma that this is revealing? And that's where we have been able to make really good gains. And I was able to kind of get more of a perspective where I could do some good, where I felt, okay, some people just need to be comforted. Yeah, you're doing it right. You know, you're taking care of business. Or yes, I know it's a terrible thing. And you know, I commiserate with you, as opposed to, you don't need to hang on the ceiling for this, you know, or you don't need to run away from home. Although I did have a patient call me up once and say, canceling my appointment because I got to get out. I got to get out of town. I said, where you going, Alpha Centauri?
Mhm.
You know, where are you going to get away from this thing? But sometimes people need to change the visuals, and I honor that they need to get away, even if the pandemic is everywhere. Um, I think every therapist needs to figure out how to be. The word isn't quite. I was going to say how to have personal integrity with this. I think a perspective that allows you to keep working without getting overwhelmed by the enormity of the situation.
Yeah, and that's what I feel
Is
like
it-
most of us have done is just stuck our head in the sand and keep chugging along and thinking, "Hey, in 3 months, 6 months, 9 months, I'll pull my head out, see if the view's any better."
I'll
But it just never
tell you why I'm
works.
smiling, because I had the exact reverse response to this. My response to it was, this might be the most interesting time in American history, and I'm here with a certain skill set and certain experiences. That was when I got the message, up your game. That's what I got. Dive in at a deeper level. Dive in, see what you can do to shift people so they don't take this nearly as hard. In fact, dive in and empower people. And that's where I made the shift
So,
internally, to be able to work at I think a very high level and not get sucked in by where I was going, that I was just overwhelmed by everything.
but how are you able to do that now when we therapists have lost so many tools we normally had to not only help patients, but cope ourselves? Like you mentioned, decompressing on the drive home. Well, luckily we have that. Um, People aren't totally homebound. Many are still in lots of areas of this. One of the largest practices in town still hasn't opened up at all. It's completely virtual, and it's again May. What about the recommendation? Hey, what you need is some time to go to the movies. You know, get out of the house, hang out with friends. That option was off the table for a long time. And so there's that powerless frustration, locked in, stir crazy
Well,
feeling.
absolutely. Well, for what for me, live music is very, very important. And I
Why?
have
Why live? Because you're performing, or
both performing and attending. So what I wound up doing when the bars opened up to live music, I would go to see local people. You didn't have to go to see a national band or a band you knew. And I found this was actually just, for me, not a surprise, but there was incredible talent on a local level. And I think people should really make use of that. And for the money you would spend on seeing a big band, not only do you get dinner, but you get to talk to the band and maybe get a T-shirt too. Um, it was that was very, very enjoyable to do, to see local people. I think the lessons of this are more on a community and interpersonal level than they are on a big national
yeah,
level,
I agree.
especially for us as therapists, in terms of excuse me, taking care of ourselves, waiting for Fleetwood Mac to come back probably ain't going to work.
Why
But
not?
because they ain't coming for a while, they can't fill the stadium. You're only allowing with the social distancing. We went to a hockey game, and I love the Tampa Bay Lightning. We went together, as a matter of fact. Now that I remember my my hockey lore, it was like going in to see the team in a Grand Canyon, but at least we got to see the game. It
And
was
it did wonders for, refreshing us, getting a break. Um, Here's some other things I want to just kind of go over. I guess you could call these statistics,
sure.
but more like trends. Okay. Mental health professionals have been flooded with new requests. We've talked about this on the show before. When this practice was seeing one new patient a week, it's now seeing 15 or 20. So that's an increase by about 20-fold, let's say. Patients who were doing well and had established with a therapist were now going back downhill and then reestablishing with their therapist, making the therapist obviously limited amount of time and resources more strained. Or the frequency would increase, right? They used to come monthly. Now they find out they're needing to come biweekly or even weekly. Increase in demand. 84% of mental health professionals reported an increase in their caseload since COVID-19 started. I'm assuming the other 16% died or something, because that was 100%. There's just,
Yeah, I thought that the American Psychological Association said 1 in 3 psychologists seeing more patients. That seems so low.
yeah, I would disagree with that. I would say, like you said before, there has not been one practice that I know of that hasn't significantly increased, unless they just stopped accepting
I
new
was about to
patients.
say, unless they were full already,
But,
maybe.
but then their acuity, they couldn't
Had
stop
to
the
go up,
acuity
had to
going
go
up,
up. Yeah.
and they're prone to burnout just the same. Um,
I
a lot.
think that for me, and I see it's on our list here, 44% of psychologists say they've seen a drop in cancellations and no-shows.
Yeah, that's an interesting phenomenon. We've seen
Yeah,
that too.
sometimes we book like the airlines, and I find my lunch when I get a cancellation, and when you don't get one.
But that makes you feel better because it shows that people either value it or recognize the need for it more. And so it's a higher priority. Making
Without a
that,
doubt, without a
for
doubt,
whatever
yeah.
the reason was that they would normally cancel. I kind of liked that. It's a little paradoxical until you think about it, but we talked to the acuity of the symptoms is going up. New patients who've never had anxiety all of a sudden have anxiety. But when we stress, we regress. And I've seen patients in my practice really go down the tubes in a seriously concerning way. Um,
Absolutely.
and trying to figure out what in the world can we do. A pill does not fix this.
No, no. The pill may give you a little more wiggle room, but it doesn't fix it at all.
The best I could hope a pill do is numb someone's feelings, and I just won't do that unless their feeling is, hey, I've got a 3 o'clock to throw myself off the skyway today, or something like
Absolutely.
that, some extreme. Uh, I tend to discourage because I don't want to contribute to the problem and have people falsely believe, oh, hey, this pill is gonna help me with this pandemic stress. Now, some people it does here and there, but it's not my go-to. It's not my first treatment.
No, I don't.
Therapy cannot be undervalued.
And I think encouraging people to live healthy, and what I mean by that is eat well, exercise, you know, um, do stress management kinds of things. I think that's always going to be good, but it's sort of not optional during this time. We're fighting, pushing against a river that's breaking a dam, and if you don't have a life preserver on, you're gonna get overwhelmed. And these are our life preservers. taking adequate nutrition, supplementation. I think that you got to have certain things now. Uh, Learning stress management techniques, knowing what you can do to cope. And for us as mental health practitioners, and for all the practitioners out there, you know what you're supposed to do. You just don't always do it. You know.
It's true. You're too busy caring for others.
Yeah.
But the pandemic's been going on for over a year at this point, and it's not abated any what the negative mental health impacts. But we already know it's going to outlast the epidemic itself.
There's no doubt the post-traumatic stress, especially number one with kids. And the other thing that I find especially frightening about all this is, you and I both treat a lot of substance abuse problems. Substance abuse has a 5 to 10 year gestation period from when it starts before it really flowers. How many teenagers that might have started drinking now are really going to be full-blown alcoholics in five
Or
to
or what about all the alcoholics and addicts we've already lost to relapse, suicide?
And that sort of begs the question of,
Homicide.
we both believe in the efficacy of the 12 steps and AA. What about the meetings that had to go to Zoom for substance abusers, whom one of the, hungry, angry, lonely, tired, right? What about that lonely thing, It wasn't the same for my people who I was treating who had serious substance abuse problems. The loneliness of this thing became a humongous trigger.
Well, and it's a lot more than that. I learned this when we I used to run my own facilitated groups for addicts, and um, at one point I needed to transition it to an online venue. And I learned a lot by that because I didn't think that it was an established group, and I didn't think that it would negatively affect these people. And boy, was I wrong, because so much of the therapy was proximity, you
Yeah.
know, which we talked about with psychiatrists and patients. I don't really think it's that important, relatively. With therapists and patients, it's more important, but I don't think it's as important as most therapists feared before the pandemic. But this is a big problem. I had people that liked having to drive all the way across town in rush hour because they were earning something. The car drive over there meant something. Having to park and walk in, and same smells, same sights, same people. More, the conversations that happened in the parking lot, all that went away, and I ended up having to close that group and go back to an in office because it was not sustainable under what I would have considered ideal circumstances. So
A lot of addiction is about the rituals that go on. And the ritual of coming to the group is not the same as just turning on your computer and going, hi.
yeah, I got some more statistics. Do we want to bore them
Go.
with more statistics? Well, we talked about this, I think, at the beginning of the show, that the changes in demand by treatment area since the pandemic began. Anxiety was number one. It increased 74%. Depression, number two, 60% increase. Trauma related disorders, 51%. Sleep disorders increased almost 50%, followed by substance. And then this is interesting, eating disorders, because of probably a loss of a sense of control.
Well, people, emotional eating. I mean, I did my dissertation on bulimia and ran an eating disorders program for 3 years. And, when something is serious enough to disrupt eating, which is a survival mechanism,
Mhm.
it's pretty serious. And Go figure that a trauma would activate more eating disorders or emotional eating, especially if there's nowhere to go but your refrigerator. That's probably the only show in town for some people.
Maybe you could hug your refrigerator too.
It's pretty big, but I'll give it a shot.
Yeah, so is a redwood. I'd like to hug a redwood.
So a tree hugger. I never knew that
Yes.
about you. Me too. I'm a tree hugger.
I ain't ashamed.
I love the redwoods. Maybe when the pandemic is over, I'll go back out there and see them.
Let's go. Sounds like a plan.
I got friends.
Um, what do you have any thoughts? I know we got a few minutes left about the concept of emotion contagion and uh compassion fatigue and the secondary traumatic stress, the efficacy of our therapy itself. Um, what are your thoughts on conceptualizing burnout in that light?
It's all real. If two people are in an elevator and one person is anxious, the other one is going to either get anxious or both of them are going to get calm when you're in a tight situation, especially with the levels of fear that we're dealing with. If you're not really good at handling your own fear, there's going to be, I think the emotion contagion is a lot like secondary traumatic stress. When you talk to somebody who's been through something horrible, you're going to be affected by it. It's like you can't help it. We have strings in every cell that the DNA is held on. And I like to think of trauma as getting those strings out of tune. When you are compassionate, and these things are to me all connected. You're compassionate with someone, and hopefully as psychotherapists, as psychological change agents, we are compassionate. We're going to resonate to some degree so that we can have accurate empathy with our patients. Well, you do take a pounding if you do that. And at some point, you're wondering, well, even though we know it's a therapeutic relationship, if you get hit too often and you don't take care of it, you're going to have fatigue. Well, what about me? It's just human nature if you're not taking care of yourself. And I think the other thing is therapists like to be seen in their own heads as effective.
Yes.
Okay, now I got to admit, if you look at the appendix in my book, I'm the only therapist I know that actually did a study to see if the therapy worked. You ask therapists, does your therapy work? They say, sure it does. They say, well, how do you know? Well, they say, well, of course it does.
I feel it.
Well, I'm sure it does. They don't have any data. The bottom line is we don't really know, but we can sense if the patients are complaining about the same things. We can, unconsciously, for some people, consciously. I mean, I make a very big effort to check out people's energy levels, emotional energy, and just literally vitality. Um, if you don't, you have to have some kind of feedback that what you're doing is effective, or you're just a mailman delivering the mail and it's never ending and nothing's going to get better. And you can't hang out in that emotional energy forever like that if you are a compassionate human being. And I would hope that if you've chosen this profession, is somewhere in the mix.
What the last thing that I would say is that there was a vast shortage, and I speak more of a psychiatrist. Even before I should have paid the lighting grip bill. Jeez. Even before the pandemic, there was this huge shortage of psychiatrists. Very difficult to get medical students to interested in a psychiatry residency. What about now? How many are going to want to go into mental health now? Because of the swamp and the sea of everyone's stressed, so it's like, oh hey, let me get into mental health so I can get more stressed while trying to help other people. I
Well,
worry about it, and it's
I'm
going to
reminded
continue to
of,
go
of the
down.
scene in
Plus most of
Casablanca.
them are boomers too, don't forget, and they either retired because of the pandemic, they're going to die or retire after the pandemic, or they're just going to get old and retire, and we're going to have a new unprecedented shortage of psychiatrists. Um, Therapists, luckily, there's more than one avenue to practice as a therapist. But psychiatrists, I don't really know a word for it. Terrifying is the best I can come up with. But they're
I'm already terrified. I wonder about, the term jumbo shrimp and mental health professional. I wonder about the training models that people have. People are not being trained for this pandemic psychology for sure. And then the other thing is, you know, there was already a shortage of psychiatrists who wanted to be more than just handing out pills, who really, in my experience, people like you are very, very rare. And I'm hoping that what we can find is a more holistic model in the future of, once again, people who are more in line with what you're doing now. They don't have to be just psychiatrists, but there seems to me to be a need for a more holistic view of the interplay between mental health and physical health. I mean, my whole practice is based on a mind body idea, uh, and working at that level. Right now, we do it piecemeal, but I can see a future where it's not exactly the same model as it is today. It's more literally more the model that you're taking. And I hope that they'll have some other way of labeling it so people won't be afraid of it. I mean, medical students won't be afraid of it.
Well, the future is uncertain, but
As Yoda said, in motion, the future always is.
indeed. So we trudge on. And in honor of this show, I have decided to take a vacation myself,
Gonna
much
take
needed
it,
one.
gonna take it till tomorrow? Or maybe you get to
No, I'm
work the
actually
whole
taking
weekend.
like a vacation with time off. I mean, I don't know.
Really?
I'm not sure when, but in the next week or two, and I think
Excellent.
for the whole week.
Wow.
Hey, speaking of next week, is next week when Dr. Goodman's coming back for part two of bioethics, or is it the week
I
after?
think it's the week after.
It's the week after.
But I could be wrong because I can't tell you what day it is today.
We should
So
find some people that know these details, but
I know.
I'm excited to have him back. Just so our viewers don't get confused, I'm going to go ahead and shave the beard so that you know which one was part one and which one was part two.
I'm not
All right,
shaving my beard, I mean.
I got to shave my beard. My wife's threatening to leave me, so that's the
Okay.
real reason.
Okay.
But it will be a nice visual cue so you don't get mixed up between part two and part
I'm
one. That
happy
would
to
be a
hear that.
travesty. That would be a travesty.
Whatever keeps you guys together, you guys are terrific.
Thanks. I work out. Until next week, we doing it? We doing it?
Be well.
Well, wow. That is truly awful.
Well, we got to keep in shape.
I work out.